Hello, I'm Peter Smith. Well, I went to medical school here starting in 1973. I did my 10 years of training after that, and it included 3 years of research, and then I joined the faculty in 1987. It's a very gratifying profession. We're doing bypass surgery usually. I do coronary bypass and valve replacement as the main things that I do clinically. And it's really just taking a patient who has a life-threatening disease and treating them and then have them do well. There's nothing better than that. I think at Duke, I can't speak of other places, but I know that at Duke what happens is the patient comes here and you get the treatment recommendation that is based on evidence. It isn't based on who you happen to run into first at Duke, and they happen to do that. It's really not in my interest to do anything other than find the best pathway for the patient based on the evidence. And we generate the evidence, we do the research, we adjudicate the evidence. We're sitting on most of the guideline committees and appropriate use criteria, so we actually are quite experienced both at the local treatment options and the national treatment options and the overall evidence that supports this. And we can take that evidence and apply it to a patient. That's why Duke is for most people. I've been a lifelong reader. I actually collect first edition mysteries, and every single day I am reading a book. And at the end of my day, no matter what the day has been like, I always read a book.